Aloha, I'm Dr. Scott Sanderson. I'm here at Thrive Medspa in Honolulu, and I just want to take a few minutes to tell you about our hair regeneration program. I feel like we have put together the most comprehensive hair regeneration program in Hawaii. So we can help people who have just started to lose their hair, all the way to people who need a full transplant and everything in between. Okay, so the process generally starts off with an assessment. Okay, so you'll come into the clinic, fill out some paperwork. We'll talk through your history, both your medical history and your hair loss history. And what I'm looking for there is anything that would indicate that you have some other cause of hair loss outside of just regular male pattern baldness or female pattern baldness. Okay, if I suspect that there's something else going on, probably going to order some labs. So we'll check some vitamin levels, some hormone levels, especially in most of our female patients, given that the most common cause of hair loss in females is metabolic. So we want to rule any of that out before we go further with our treatments, okay? If there's certain things that you tell me that make me suspect other causes, I may do some trichoscopy. So take this microscope, we'll take a look at your scalp, and I'm looking at the health of the scalp, I'm looking at the follicles themselves, and I'm looking at the hairs. And there are characteristics that you can see on trichoscopy that will give you a better idea of what's actually happening. So there's a pattern of the density and the thickness of hairs that you see with male pattern baldness, and there's a different pattern that you see with alopecia areata, and there's different patterns that you see with inflammatory causes of hair loss. So that could be really important for people. And so after the assessment, we make an individualized plan, whether you need us just to help you thicken up your hair, to halt current hair loss, or to do a full transplant, or both. Okay, so some people, we want to thicken up some areas and then we want to transplant other areas. All right, and so we're going to make a plan really to help you to meet your hair growth and hair regeneration goals. Okay, sometimes we'll include medications with those, some to block DHT, some to stimulate growth. So various different medications, again, depends on preferences and depends on the patient's history. We also have supplements that we use. So we use Nutrafol. We like Nutrafol a lot because it's really one of the only supplements out there that actually has evidence behind it. They actually did research and they've proven that it's effective. I like Nutrafol as well because it does address multiple causes of hair loss. It's not just like that one supplement that's just trying to address one deficiency. So they address vitamin deficiencies, they address stress, they address inflammation, and they address hormones. So overall, a good supplement for helping people to grow their hair. And it can just help anything else that we're doing to get better results. Nutrafol also has some shampoo and conditioner and some growth serums. We like those as well. So one of our modalities that we use a lot is PRP or PRF injections. So we can take your growth factors and we can isolate those and we can inject those into the scalp, and that's going to help you to regrow hair. Okay? If it's an area where you have no follicles left, the PRP or the PRF isn't going to be helpful. But rather than the PRP and PRF, we are now kind of moving more towards exosomes. So with the exosomes, it's a cell signaling molecule, I'll say, okay, from stem cells. So we get those cell signaling molecules, and what they're going to do is they're going to help reactivate the Wnt pathway. So the Wnt pathway in the hair follicles, all the cells in the body, is very important for growth. Okay, so that gets turned off by DHT and some other causes of hair loss. They all have that kind of common pathway that it deactivates the Wnt pathway. So we can reactivate that with these exosomes. They also decrease inflammation and help the follicles to produce more keratin, which is actually what your hair is made out of. So that is completely painless. So we're really happy about this. The results that we're seeing are amazing, as good or better even than the PRP or the PRF. So we'll be transitioning over to that more often, and this is how we actually drive that into the scalp. So we take the exosomes, we take the serum, we place it on the scalp, and then this is an ultrasound. So we activate the ultrasound, place it on the scalp, and that ultrasound energy can drive the exosomes into the scalp. If you're familiar with ultrasound, you may know that the energy can be tweaked and you can do all sorts of things with it. You can break up kidney stones with it, you can break up inflammation in a tendon. So a lot of different things depending on the energy level. This is just enough energy to drive the exosomes into the scalp. So it's actually quite relaxing. It feels maybe a little bit warm. You might feel a little bit of tapping on the scalp, but absolutely painless. And then for people who need more than just some thickening and some regeneration of the hair, we have ways to transplant the hair. We are the first and only practice in Hawaii to have the newest version of the ARTIS robot. So it's an amazing device that makes the hair transplants go better, faster, and get better results. So we use the robot mostly for the harvesting of the cells. Now it harvests individual follicles, and then we place those individual follicles wherever we want the person to grow hair. And it gives you a very natural, I mean, it's essentially indistinguishable from natural hair because it's one follicle at a time. And so we just look at where the patient needs hair. We generally take it from the back and move it to the front. That's the most common thing that we do with that. The beauty of that is that that hair is permanent when we transplant it. So this hair in the back, it doesn't have the same sensitivity to DHT that the hair in the front does. That's DHT is what causes that male pattern baldness and the female pattern baldness, because these hairs are sensitive to it, but these hairs are not. So when we take these hairs in the back and we move them to the front, they maintain that lack of sensitivity. So that's a beautiful thing. So it makes it permanent. So when you get the hair transplant, it's not going to fall out like the other hair did. And so for people who are not necessarily candidates for the artist robot, because not everybody is, we have the neograft. Sometimes people with certain characteristics of their hair, like maybe it's a really, really curly hair, we're going to use the neograft instead. Or maybe we're just doing a very small area, we'll use the neograft instead. So we have modalities that are going to help you to have your best chance of having a full head of hair throughout any part of a hair loss life, or a journey, I guess I should say. So we can help you to regrow that, regenerate that hair, make it thicker. We can put hair where you've completely lost hair. So if you're interested, you can just reach out to us. You can call us at 523-5483. You can find us on the web. It's thrivemedspa.com, or you can find us on Instagram. It's Scott Sanderson, MD.